I went to the doctors when I was about 14 with this. I asked the doctor if there was a way to damage my ears.
Breathing is annoying for me. Actually, it's a discussion with my husband. He's telling me I have to breathe, so
Right.
what can I do? The people that don't have misophonia will not understand the
No,
anger that it triggers.
relationships have failed for me because of misophonia. This is not a choice. I can't emphasize this enough. This is not just like being difficult.
Why it is getting worse with age, and how can we cope actually in circumstances that we cannot control?
Hello, everybody, and welcome to this week's episode of That Resonates, where we break down all things related to psychology and psychotherapy. With me today, we have Léa Kiwan, who is a really good friend of mine, and she also takes care of the marketing and the podcast and the content creation behind Resonate Wellbeing. We're going to talk, though, today about something that we both experience,
Yeah.
which is a pretty niche disorder called misophonia. So we're going to get into that. But do you want to introduce yourself a little bit and tell me about Lemmy and Partners and what you
So
do for Resonate? And
yeah, thanks, Chris, for introducing me, and I'm so happy to be here to talk about something totally different than we usually talk about. So yes, we're helping you with the marketing strategy, with the digital, so creating content, but mainly the strategy that you put for Resonate that will follow. So and I cannot talk a lot about it because it's coming.
sure.
So keep it as a suspense. But yeah, we handle all the marketing, and thank you for trusting us, by the way, for this. And hopefully everyone will like it also.
Yeah.
And yeah, thanks again for having me.
No, it's been great so far. I love kind of what we're doing, and I'm so happy with how it's all going. But we got talking sometime. I don't know how we realized that we both suffer with misophonia.
I'm not sure
Um,
actually. Maybe yeah. I don't know. I don't remember.
No, I'm not sure either, because it's quite niche. But
Yeah.
I guess to begin with, so misophonia, the word itself, the etymology of it, the history of the word, is rooted in Greek. Miso means hatred, and phonia means sound or voice. So it literally means hatred of sound. And misophonia it's not quite a disorder yet because it's not recognized by the American Psychological or Psychiatric Association, but it probably will be soon. It's, I guess, a collection of symptoms related to a real disdain and intolerance for the sounds that people
Yeah.
make, right? Like loud chewing, and I don't want to trigger anybody, but I'm not going to do it. But the smacking sound that people make when they
Yeah.
chew, nose breathing, yawning loudly.
Any sound that is repetitive basically is annoying. And
Right.
it's annoying to the point that you just like have to leave the room because you might, I don't know, you might get angry at the person without him understanding why. And to be honest, from my side, I didn't know that it's a thing or it's a disorder until a couple of years back. So before that, I didn't know. I thought I
Right.
was the only one on earth
Right.
experiencing this.
And I remember that I'm getting flashbacks now to a conversation in my office at DMU with you
Yeah.
about this. So we must have maybe been equally irritated by something someone was doing in a meeting or something.
Maybe,
There must
yeah.
have been something. And then I do remember you asking me about it. Or I think I said to you, "Oh, it's
Mm.
misophonia. It's a thing." And you're
Yeah,
like, "Really?"
maybe.
And then it kind of developed from there. So misophonia is this kind of unreasonable and unreasonably extreme emotional reaction to a trigger sound. And I want to spend a good like 15 minutes really differentiating this from just being irritated by sounds.
Mm.
We're not talking about just being annoyed by construction sound outside or keyboards tapping, although that can be extremely irritating for
Yeah.
someone with misophonia. We're not just talking about kind of low level irritation. We're talking about extreme emotional reactions. So somebody who's sat next to someone who's chewing loudly in a cafe will have disgust, anger, rage, and anxiety. Right? You'll have to leave if
Yeah.
that's happening. Right?
Actually, what happens is that when I am in the room and someone is chewing, like you said, or even breathing in a specific way, or I can hear the breathing, I get so irritated that all my focus is on that person and what he's
Yeah.
doing. So
Okay.
it's annoying for me also because I cannot continue like my life normally without
Yeah.
just having this and being annoyed.
Yeah.
And even let's say I'm at the movies and I hear someone eating popcorn, as simple as that. And then all my focus is on that person eating the popcorn, and I just skip the movie and my focus is there, So it is irritating for me also because it keeps me doing things that I want, and
Right.
continuing normal life. So
Mm.
this is annoying. And I think that I'm not sure about you, but we discussed maybe once about it, then when it started. And for me, it started since I was born, to be honest.
Mm.
So all my life I was like that. I remember even driving back like with my in my car, in my parents' car back then, and I used to get annoyed with specific noises of, let's say, I don't know, just like simple noises of, let's say, my dad is eating, or, even though he's like normal eating, but I get annoyed about that. And all the drive, I remember it till now, the anger that I had all the drive from our house to, let's say, to the school. I don't know. But I remember this anger that I used to have related to this. Or even when I'm at school and I have an exam, let's say, and I have someone next to me just like doing something with the pen, right? The thing,
Mm.
and all my focus is on that. And then I cannot anymore just continue with the exam
Yeah.
because my focus is on the pen there and the sound there. Or someone doing something with, it's not, it's beyond also the sounds. And this is what we were discussed before. And you're going to tell me more because you're the pro here and I want your opinion even more about it. But yeah, how can you explain this? Are we born with it or it grows on us?
Good question. Well, first of all, just to chime in with my experience as well of the symptoms, it's interesting that you say it's been there for as long as you can remember, because for me it was distinctly maybe 10 or 11, I think that I seem to recall. But then I do have a notoriously bad memory of my childhood. I don't really, and my mum laughs about it. I'll mention things that I think happened when I was 12, and my mum will be like, "That happened when you were 4," you know?
Mm.
Like my grandma dying. My grandma died, I think, when I was 4, and I thought it was when I was 11. So I can't be too confident if it was 11 or whatever when misophonia hit me, but my mum would probably know more. But I definitely remember it being kind of like sort of pre-puberty time at 10, 11. That's when I was kind of noticing loud breathing, loud chewing, yawning became and the thing with misophonia is more trigger cells develop, don't they? Right? So it might start off with a few, the loud chewing with your dad, but then foot tapping, clicking fingers, whatever. So more trigger sounds develop over the life course, which is why this is a chronic disorder. Chronic meaning sort of long lasting. It's not going to go away anytime soon, right? So my big triggers now. Let's go. One for one here. Definitely loud chewing, nose breathing, as we've mentioned. Some more niche ones. Yeah, yawning when people do this, like ooh,
Yeah, yeah.
right. That like it. I could see the kind of discomfort
Yeah.
about it, right? What about you? Is there any noises that are not that common? Do you think?
Now it's becoming even worse with age. I feel even, as I told you, even, breathing is annoying for me.
Yeah.
And actually, it's a discussion with my husband. If he sees this, he's gonna kill me. But sometimes it's just, yeah, he's telling me I have to breathe, So
Right.
what can I do? And the problem is the people that who don't have misophonia will not understand the
No.
anger that it triggers,
Yeah.
because sometimes we might have, if you want the remark that, okay, but you're doing this, right?
Mm.
Like, okay, tell me that you're annoyed if I did something. I
Right.
stop. And this is always discussion with everyone around, And the worst thing ever is if someone is chewing and having a chewing gum. This is like, honestly, it can ruin my day.
Yeah.
Because imagine having someone next to you is a sound, but also the fact that he's chewing and like doing this repetitive thing it is so annoying. And sometimes you cannot tell the person, right? Because if you don't know the person enough to tell them, he's gonna feel, are you a freak or something? Like, why are you annoyed? So how can you
Yeah.
explain this without impacting the relationships that you have?
Mm. It's horrible, and we kinda laugh at it and probably do a disservice, and I wanna kinda really take a moment and respond to anyone listening to this that suffers, and apparently it's as high as 20% of people.
Okay, I didn't know that.
There was research in the early 2000s that suggested prevalence was 20%, 1 in 5. More recent, more careful research, that kinda tightens the threshold, i.e., it looked at the most extreme responses, is more like 5%.
Okay.
But either way, we're still talking a very common disorder. even though we don't call it a disorder yet because it's not official, right? But so it's a lot of people that suffer. So I want to really kind of speak to those that do suffer and say that whilst we kind of maybe laugh while we talk about it, I think that's become a coping mechanism, you know. But for someone who's suffering, this is really serious and it affects relationships. I can absolutely say that relationships have failed for me because of misophonia,
Can we keep this?
right? Can we,
Can we keep this shot?
yeah, we can, yeah. Absolutely. And there'll be,
They'll be happy to hear about.
yeah. A couple of people have reached out since and sent me links to misophonia and been like, oh, this is why we broke up. Now, to be clear, I didn't break up with anybody because of
Because of
misophonia,
that.
but it caused a great deal of tension. And it's horrible because you feel terrible. You feel constantly ashamed of the irritation, but you cannot stop.
Yeah.
And what I want to say to people who don't understand misophonia is this is not a choice, right?
Yeah.
I can't emphasize this enough. This is not just like being difficult.
Exactly. This is what I want to also
Yeah.
to make sure everyone understand that it's not we cannot do an effort,
Yeah.
right? To just like ignore the noise or the sound or whatever. It's
Yeah.
just, it is irritating for us,
Yeah.
So this is what maybe some people won't understand.
Yeah, and I can understand people who don't get misophonia looking at this and thinking, "Wow, what a couple of like really difficult, awkward people who just think that they're." And I accept that I make noises. I accept that
Yeah.
I will have trigger noises as well. This is not like a perfectionism thing. It's and we'll get to the kind of brain basis for it in a minute, but it's not a choice. It's not something that we're pleased with. It's not a minor irritation. It is a visceral emotional reaction that we cannot help. Now, I went to the doctors when I was about 14 with this, and I asked the doctor if there was a way to damage my ears so that I could no
Really? Oh
longer.
my God. Okay.
Yeah, that's how bad it got for me. I asked the doctor if there was a way that I could sort of damage my ears so that I could cut out this sound.
Wow.
And so it's not voluntary, and it drives quite a lot of what we call comorbidities, coexistent conditions like anxiety, isolation, social isolation. You stop wanting to spend
Exactly.
time.
It can impact, yeah. And that's what I wanted because it actually now it came to me that sometimes when you are, let's say, sitting on the dining table with your family or with your friends and so on, and then that, in this setting, like someone will trigger you or will, and that person, for example, that does this sounds usually, so you expect that he's gonna do the sound. So you come expecting this and you get a note even before.
Yes.
This is what happens. So I don't know if it happens to you also that you get a note even before because you're expecting that that person will make
Yeah.
this noise 100%.
I will start getting anxious about Christmas
Yeah.
in October. Seriously,
Really.
because I'm like, I'm gonna have to sit around the table of 12 people that I know chew loudly or scrape the plate or breathe,
Yeah.
audibly. And again, I know it sounds awful. I love these people. I would die for them gladly,
Yeah.
but I can't help it. And luckily, they're all learning about it now, and they kind of forgive me. But there's been a lot of shame, a lot of embarrassment, and a lot of difficulty. And I'm not trying to get everyone to feel sorry for me, or you. But I really want to emphasize anyone suffering, it's not your fault. You can't really do anything about it. We'll get to some
Yeah.
treatment ideas in a minute, but there's a brain basis for it. There's a neurological basis for it.
Yeah, true.
Now, one thing that you touched on there is the fancy word for that is anticipatory anxiety. So you're anticipating the noise coming because you're familiar with sitting down at the table with people that you know what sounds they're going to make. And so the tension begins now before you even got there. And of course, this is why it gets worse as you grow older because you have more of a script. You learn about how things go. And so you expect more sounds, you're triggered by more sounds, and you're surrounded by more context within which those sounds will take place.
This is what I want to ask you actually, why it is getting worse with age. Because now, like, even for example, I'm flying, I'm taking a flight, and then I have someone next to me who's sick, and then, like doing,
Yeah.
like that, all the flight, I don't know what to do with it. I
Yeah.
just go back and forth to my seat just like to avoid a bit of, the sounds that I'm hearing.
Yeah.
But why it is, getting worse with age? And how can we cope actually with in circumstances that we cannot control?
Because it's getting worse with age because you're learning more sounds, basically. Now, if you think about the first time you ever got a flight, it would have been novel, or maybe you're a kid, you'd be looking out the window, you'd have been distracted by things. The second time you get a flight, you might notice more things because it's less novel. The third time, the fourth time, the 20th time you get a flight, you don't notice anything. So you've got more capacity to notice the person next to you who's breathing loudly. Now, if you magnify that in terms of family settings, a meal, going to a football match and being next to someone, going to the cinema, the first time you go to the cinema, it's novel. So you don't really have the capacity to process all the sounds around you. After you've been to the cinema 20 times, you can now hear the popcorn rustling and the chewing. So we call that contextual habituation.
Okay.
You get used to the environment, right? So much so that now you've got more capacity to take in different sounds. And what misophonia does, as you know, is it focuses in on a trigger sound, and it's as if nothing else is happening.
Exactly.
I hear you. I've been to the cinema with friends who nose breathe, you know.
You have so a mix of both.
Yeah, right. And as soon as I hear it, I'm screwed, you know.
Mm.
And one thing, it's shameful to admit, but I'll go to the bathroom and get some tissue paper or something and try and
Yeah.
use them to block my ears, or I'll have earplugs.
Sometimes this
Um,
was my solution actually, to have earplugs everywhere I go, just in case,
yeah.
especially in circumstances that I cannot change where I am, like on the flight, for example, or in the movies. So I have them just in case,
Yeah.
as a backup plan.
Right.
So yeah.
Me too. Again, just to emphasize, this is not a choice. It's not about being difficult. It's not a preference.
Yeah.
It's an immediate, visceral, emotional reaction, and it's something that we cannot control. And there's no use trying to control it. Now, just to add one thing is, I've been to therapists about this. Now, some psychotherapists have tried to find what we call an explanatory reason. So something that explains the behavior, like the rationality behind it. So they might say, one psychotherapist sort of said that I needed control over
Okay.
situations. So it was my way of controlling situations. And the noises that people made were a kind of sign of a lack of control. So basically saying I was a control freak, right?
Okay.
It's nonsense. It's just they didn't
Yeah.
understand misophonia. Another psychotherapist tried to suggest that it was rooted in childhood and it was rooted in kind of a general disdain for sounds and loud noises, a bit of a psychoanalytic, idea. That's nonsense as well.
Okay.
This is not what we call an explanatory disorder. It's neurobiological. So it's neurological. There is a brain basis, which means there's no rationality behind it. We're not doing it for any underpinning psychological reason or to gain something. It is just the noise happens, we have the
Trigger.
response.
Yeah.
Right.
So there's no actual explanation on why we
No.
have this and why some people have it and why other people know.
No,
Okay.
absolutely. Well, minimal to no social explanation. And in psychology, there's always this debate between nature and nurture. So nature, genetics, brain basis, neurobiology, neurochemistry, the things that are outside of our control. And then nurture is the things that we grow up with. And a lot of things are pretty much 50-50.
Yeah.
So, for example, state, trait, anger. So the experience of being an angry person. It might be genetic. So if your parents were angry and those before, there's a genetic explanation. There might be neurological bases to anger. So heightened amygdalic activity, so your amygdala in your brain. But there might be social explanations. You grew up around anger. You went to a school where people were angry. Your father or your mother was very angry. So an element of the behavior is learned, right? So you can learn anger. With misophonia, it's not like that.
No.
It's all kind of nature.
Yeah. Okay.
That's what we think. Now,
Yeah.
so to get onto that, I'm going to try and explain what I've learned about the brain basis.
Mm.
So the kind of smoking gun or the evidence points to the AIC in the brain, the anterior insular cortex in the brain. This is housed quite deep in the brain, is in charge of things like emotion regulation. So, when you're driving and someone cuts you up, someone who's highly emotionally regulated is not gonna, want to get out of the car and kill that person. Someone who's got poor emotion regulation will react. This part of the brain, the insula, is involved in things like emotion regulation. Now, I think that we're fine with driving. We're not going to respond negatively to. We're not going to get kind of driving
Yeah,
rage,
I don't
right?
think so.
We're not going to get really angry at someone who bumps into us. We're generally very calm
Yeah,
people,
yeah.
which is
I mean,
also
it depends.
right. Yeah, for sure. So we don't have a general problem, and that's why we know that we have misophonia because this is very specific to sounds, right? So anyway, so the insula is responsible for things like emotion regulation, but it's also responsible for something called salience processing, right?
What is that?
Now, salience is about sounds or stimuli, sensory stimuli, sounds, sight, touch, that we focus on in the now. So something that is salient, it requires our attention now, right? So this part of the brain basically orders and prioritizes an array of sensory stimuli. If you imagine right now, we've got to process the temperature in the room. I can feel it's quite cold right now if I focus on it. If you really,
No, I didn't
for me, I
notice
feel
it.
it's cooling down because I've been really hot.
Okay, I
But
didn't notice that. So
right, so right now, because I can feel the aircon, it's salient. It's something that I can feel right now. If I now try and smell something, what does the room smell like? I can now smell my perfume, right? My aftershave.
mm,
So the fact that I'm focusing on that now, that becomes salient. Now the insula is responsible for ordering all of these different pieces of information. And it exists in a network involving emotion responses, awareness, attention. What we find in people with misophonia is the anterior insular cortex and the network it belongs to is really in hyperdrive.
okay. Actually, now you said that. I mean, it's a bit complicated for me
Yeah,
here,
right.
but the fact that you mentioned, for example, the air conditioning, now I can hear it a lot.
Right. There you
Yeah, it's
go.
like so loud, you know?
Okay, right. That's a perfect
Yeah.
example. So the fact that I've named it,
Mm,
now you can't focus on anything else.
mm,
And quote unquote normal people will notice it and then get back to
yeah.
task. You and I, we have a salience problem,
Mm,
right? So we are not ordering things in terms of importance in a normative, typical way. So if somebody here is chewing, that is the only thing we will find
yeah,
salient,
true.
right? And it's because of what this insula is doing. If you scan our brains, if you put us in an fMRI,
Mm,
so a functional magnetic resonance
mm,
imaging,
mm,
it will light up, and you play a sound like breathing, loud
mm.
breathing. That network involving the insula will be really kind of lighting up, basically.
Okay,
It'll be
interesting.
responding.
Were there any funny situation that you had, for example, that triggered you and then you had to find like solution maybe to to get over what you're hearing or what you're experiencing or the anger that you had?
Yeah. It's difficult to mention without implicating people, isn't it? I don't wanna
It's
mention
fine.
people, but I I stayed for 4 days
Mm.
with, some friends a couple of years ago. Let's say it was a ski trip to hide the identity, right?
Okay.
Right?
Yeah.
It wasn't, but,
So it was a ski trip.
yeah, it
Yeah.
was a ski trip, right? And one of the people there just was sniffing
Okay.
all the time,
Yeah.
right? So I'm not gonna do it because I don't wanna trigger anybody,
Yeah.
especially you, but just constant sniffing all the time. And the trouble with misophonia is pattern recognition. As you mentioned, as soon as you recognize the pattern, that's it. You're
Mm.
doomed. Yeah.
Actually, for me, it was like I remember two things. Like one of them I cannot tell you about because like definitely the person will recognize himself. But I was like when I was younger, I was having a sleepover at my friend's place. So I was sleeping at her place. She knows her, she's gonna know herself if she listened to this. But so I was sleeping there, and we are in one room. And then while trying, I was trying to sleep, and then I noticed the clock that was in the living room, which is far from the room where we are.
Mm,
So I started noticing it. And obviously the clock is a pattern, right? And I couldn't focus on anything else. I couldn't sleep. I couldn't do anything. The only solution that I found that I went over to the living room, took out the clock,
mhm,
take out the battery to be able to sleep, and I put it on the table. And then the next day, the parents, like my friend's parents, asked us, like, who did this? Why did you take out the battery? I was like, I'm so sorry, but I couldn't sleep. And I was younger. I was a teenager back then.
Yeah, right.
So I remember very well because it was embarrassing. Because for me, I wanted to wake up earlier to fix it, to put it back, but I couldn't. I was still sleeping. And they discovered that. So
It's so funny you say that. So I used to work in the Samaritans in the UK, which deals with suicidal callers or people with suicide ideation and despair. So we used to work on the phones, and we had clocks everywhere, 3 or 4 clocks in the room. And after one of my shifts, we used to do what's called a download. So you'd have to call the leader of the shift and talk about your calls as like a safeguarding measure. And they said, was it you that removed all of the batteries in the I forgot to put it all back in again.
yeah.
And every time I was on shift, there used to be a joke, that a Christian can't tolerate. You
Yeah.
take your own phone because you won't know what time it is, or, you know, uh, I think that was kind of almost pre-phones. So take a watch because you won't know what time it is. And so I'm the same. I can't handle it. And I can still hear the aircon now. I'm focusing on the aircon, right?
And yeah. Yeah.
Um, so yeah, that's a perfect example. But I want to also emphasize that this is a problem mainly to do with what we call orofacial stimuli. So things that come from the mouth often, things that come from humans. We, as misophonics and misoponics, will struggle with repetitive sounds generally. But in terms of hierarchy, it's sounds that people make.
True.
Then repetitive high frequency sounds, like the tapping of a keyboard is quite a clicky kind of high pitched sound. Aircon is quite high frequency, so that will irritate us as well. And then a bit lower down, really interestingly, research is finding visual cues.
Yeah, true. I
You
have
know,
this. Yeah.
can you tell me about some visual
So
cues?
if you're doing like this with your
In your
with your
company, I try not to do that. I do that a lot.
no, I was like, at some point I was like noticing, am I doing it? I was, yeah, if someone is doing this in front of me, I just get annoyed also. Is there a solution? Can we do like an exercise to just diminish this, if you want, anger that you have?
Yeah, so coming back to the brain basis a bit without getting too nuanced with it, we know that it's an involuntary response. There's a brain basis. Picture a cross wiring of the emotion system in your brain. When we hear a sound, the emotion system in our brain lights up. It's pretty much nothing you can do about that, except for tolerate it, except for kind of gently expose yourself more and more to sounds. Um, in terms of treatment, good old CBT has been studied. There's been a kind of an extensive study on a multitude of therapeutic resources for misophonia, and CBT kind of wins the race, which I'm surprised about because CBT, cognitive behavioral therapy, is a talking therapy, and it's about deconstructing thoughts, behaviors, emotions, feelings, etc. And I personally know that I wouldn't respond very well, I don't think. But the treatment effect has been reported at about 40%. So meaning that it's actually 37%. So 37% of people that went through CBT for misophonia improved,
Okay.
as opposed to zero that, went through another type of talking therapy. And what CBT will do is it will focus in on how you're making sense of the sound. And it will, okay, right, we might work up towards playing a trigger sound, and then trying to understand what's going on when you hear that sound. Where do you feel it in your body? Do you have an embodied response? We can practice mindfulness interventions. Okay, while that's going on, just breathe for me. Notice it. Notice where you feel that sound in your body. Where's the irritation? And I want you to notice and name the thought. So I'm noticing the thought that this is driving me insane. I'm noticing the thought, that I need that person to stop. Okay, I just want you to exist with that for a moment. And so it's about breaking down that kind of response and slowing things down so that instead of it being an automated, involuntary, high emotional reaction, it's more considered.
Mm. And I have question for you that we discussed maybe before about it. The only exception that I have is my son, right? So
This is really interesting.
yeah, the only person on earth that can breathe like he wants or eat with like he wants, right? And I don't get annoyed.
I'm so interested in this, and I know that I will be this. I don't have kids, but I know that I'll be the same. And I think it's something to do with your son being an extension of you directly. I think it's something to do. I don't mean this in a bad way. I think it's something to do with what Piaget called egocentricity. You know, it's kind of like you just don't notice it in the same way. A bit like you wouldn't notice your own breathing and be irritated by it. You know, your son is such a close extension of you that there's nothing you could do that would irritate you
Yeah.
because he kind of is you. I feel like there's something in that.
I don't know because like even when he's sleeping, let's say I don't know, I'm just random. He breathes loudly or whatever. Usually I get so annoyed, but for him I look at him, oh my god, that's so cute, you know?
Yeah, right.
So it's that emotion that is triggered, not the
Yeah.
anger, you know?
Yeah, well, one thing that maybe I'm just sort of spitballing here is it might be something to do with oxytocin.
Okay.
Oxytocin is a neurochemical that you feel when you find, baby's cute or, a cute puppy or whatever. You get this flood of warmth
Mm,
that, oh my God, so cute. That's oxytocin, right?
mm,
And a bit of me wonders if the neurochemistry of oxytocin is neutralizing the
mm.
heightened emotional reaction that you might have, you know.
Actually, since you mentioned the puppy, because I know that at some point, like you had a dog also,
Hmm.
were you annoyed by the sound of
Never.
the you see?
Yeah,
Mm,
interesting. That's a really interesting point.
mm,
Some people will be irritated by dogs. In one of the papers that I read, dogs scratching on the floor, paws scratching on laminate flooring was like a
mm.
big trigger sound.
It
But
doesn't trigger me when
no,
dog do it. Yeah.
and if it was my dog, so like Teddy,
Mm,
the kind of family dog that I adore, and Willow, my mum's dog, I don't think there's a noise they could make that would irritate me.
see, yeah, same for my
Yeah.
dog also. Yeah.
Which probably doesn't for the viewer now or for the listener, that probably doesn't help our case in terms of, like, being difficult.
Yeah, because it's I mean, it just I do there's no explanation I feel for this,
Right.
right? Like I'm trying because the amount of anger that triggers us usually is just
Yeah.
we can't control and we cannot even explain to someone who doesn't have it.
Yeah.
But in the same time, we cannot explain why in that case, in these two cases,
Yeah.
particular cases, whether it's kids or puppies or dogs, whatever,
Mm.
we're not annoyed in that case. So it's definitely psychological.
Yeah, well, I think it's important to keep saying that it's neurobiological, that
Mm.
there's not not a lot you can do about it, and there are a lot of anomalous, parts of misophonia. There's a lot of it that just doesn't make sense,
No.
and just as you think you've nailed down a pattern, it'll surprise you. I read recently that because I always thought that I have incredible hearing, and everyone says I do,
Someone
right?
told me this once,
Yeah.
and I took it seriously because now whenever I go, even and like just sorry, I cut you off, but
No, it's okay.
I even like last time I was in Paris, I was for work and then I was staying at a hotel. And then suddenly I started hearing something really from far. I don't know if it's a an air conditioning or something. And I couldn't sleep because of that.
Mm,
But it's in the same time, it's silent. You know what I mean?
yeah.
There's something really far away that I'm hearing, maybe someone else wouldn't hear. So
Yeah.
is it me having like, I don't know, like this power of hearing a lot
Right.
or, you know?
Well, yeah, so I thought that as a consequence of that I just had amazing hearing.
Mm.
So there's been studies on this. It turns out that we don't have better hearing than anybody who's not misophonic, but because of the attention we're able to allocate to noises,
Okay.
it feels like we have better hearing. So
Mm.
I can hear plug sockets. If you put a plug in now and you turn it on, I can hear the electric whirring through the wire.
Mm.
So I think, well, I've got better hearing than most people. It turns out that it's just that I can allocate attention to that. Does that make sense?
Yeah, no, no,
Whereas somebody else,
yeah.
they will be able to hear it, but they just can't allocate the attention to it. So it's slightly different, right?
Mm.
So apparently it's a myth that we have better hearing. It's also a myth that we would be disturbed by loud sounds. So like
It's a mix of both. Yeah.
you would think that a siren for an ambulance, it would disturb us more than someone without misophonia. That's
Mm.
not true.
Mm.
Everyone is equally annoyed by those sounds because 'cause they're supposed
Yeah.
to be annoying, right? So yeah, it's a strange one,
Yeah.
and
But just yeah, I remember also another sound that really triggers me. When used to live in Paris, you know, sometimes the walls are too thin
mm,
between the apartments, and sometimes even you can hear two people talking in another apartment, you know, and
mm,
just like,
like a
oh my god, this is so annoying.
yeah.
This kills me. Yeah.
Yeah,
So
there's There's more trigger sounds now. Oh, one of them.
Mm.
This is the ultimate for me at the moment.
Yeah.
The vocal fry.
What
It's
do you
called the
mean?
vocal fry, right? And I risk sounding like a real, whatever, difficult person now. But
Yeah.
a vocal fry is Americans do it a lot more, I've noticed, is when you're talking normally and then at the end of the sentence you start to reduce the and you make this like the sound,
Okay.
right? So without without really without offending our American audience, Californians are especially bad. Now, for the editor, can you find can you find a clip from Loudermilk, the coffee shop scene? Have you seen this?
No.
Right.
Not sure.
Well, there's a series called Loudermilk, and there's a coffee shop scene where he says, just play it. Editor, play the scene.
Why are you talking like that?
Why are you talking like that?
Because this is my voice?
This is my voice.
No, it's not. I heard you talking a minute ago. I know you don't talk like that.
Neither do you, because nobody actually talks like this. You choose to talk like this, and today I chose to talk like this. Pretty fucking annoying, isn't it?
Why are you so rude, man?
Just stop doing that.
I can't help it. It's my voice.
No, it's not. It's an affectation.
Yeah.
So it happens more with this Californian drawl, and I spent 6 months in California, and I must say the like and literally thing it started to drive me mad. It's not quite. I think a lot of people just find it irritating, but like literally, I was like at the beach like yesterday, and like I got like a bagel, and it was like really nice. And this fry thing, I'm like, I need to get out. I need to get out of the way. I can't deal with it, and
Okay.
it's an issue because a lot of podcasts and a lot of audiobooks are from
Yeah.
people who have that kind of strong American Californian sort of thing.
Okay. We talked about it. It is. Can you make people around us have this empathy?
Oh, great question.
Because we can. I mean, at the beginning, they will be like, yeah, sorry, okay. But on the long term, it might be a lot to ask.
Yes.
So how can create that?
Right. So yeah. So coming back to treatments, just before I make that point, CBT has a pretty good treatment effect. So if you're someone struggling with misophonia, consider CBT. Other things to consider. One thing in the research that I found interesting is white noise. So you can use headphones to create white noise, and it seems that people can tolerate trigger sounds when accompanied with low-level white noise. It reduces the impact. So the chewing that you hate, imagine if you had a whirring at the same time, it reduces the impact. And there's some research that indicates that you can build your tolerance, which is essentially like exposure therapy. However, exposure therapy is pretty controversial, and there's mixed
Yeah.
results. It can make people worse because it increases that anticipatory anxiety.
Okay.
Exposure therapy is where you play it all the time. We flood you with the noise.
So you get used to it more.
Exactly.
Okay.
But it doesn't really work with misophonia.
I tried it, to be
Yeah.
honest. I read it somewhere randomly, and because I wanted solution to anything, and it didn't work.
I tried it and just
Yeah.
wanted to jump off a bridge immediately. Like it didn't work for me at all. So one thing and I've worked with people, by the way, with misophonia, and the thing that I do as quick as possible is get the supportive partner in to explain to the partner. I do a lot of psychoeducation. This is not about you. They don't hate you. It might feel like that. They really love you and they feel shame about these noises. It's a neurobiological issue, and your partner cannot help it. And I advise being able to communicate about it with your partner, being able to laugh about it. I've had some partners that hated me because I was constantly pointing stuff out, which I can understand.
And with your friends?
Yeah, friends,
Same.
and I've had some partners and friends that have been amazing with it. And for me, the thing that has made the difference is being able to laugh about it and being able to mention it. Now, one thing that completely reduces my reaction is when the person themselves labels the fact that they're doing it, when they acknowledge they're doing it.
Okay.
So if I sit down with a friend, and there's a really good friend of mine in the UK that used to do this with me, it's called Phil. He was amazing with it. He just understood, right? So we sit down for a meal, and before we went, he'd be like, "Are you going to get annoyed at me, aren't you, when we sit down?" I'm like, "No, I won't." And he's like, "All right, I'm going to eat for 10 minutes. I'm probably going to chew loudly. I know I'm doing it. I love you. I love you, buddy. Just, we'll get through it together." And the fact that he does that,
Yeah.
it completely kills it, which is odd. It literally doesn't bother me then. I don't know about you, if you tried that or if it would still bother you, but for me, it's strange. And this is emerging in the research that when we notice and name it out loud, it dissipates.
Yeah. But
Uh,
sometimes it's just the situation. If I don't know well the person,
yeah, then you,
I can't tell this person that. But
yeah,
now, like because of this, episode, I can tell everyone like, okay, just like please,
yeah.
can you
Maybe
control yourself?
maybe you can like wear a necklace that says, like, I have
Yeah.
misophonia on it, and a QR code that links to this podcast. Yeah, in that situation there, there's not a lot you can do. Because we can't start telling people, off that make
Yeah.
noises. So that's just something that we're gonna have to keep dealing with. But I'm hoping that podcasts like this, get the message out. People learning about misophonia a lot more. I'm seeing a lot of Instagram reels about it.
Now, yeah, now more people are aware, I feel, about this topic and
Yeah.
just like trying to find solutions, but I doubt they will. But yeah.
CBT is something to consider.
Okay.
White noise, some exposure response prevention type of work, which is where you're exposed to the noise.
Okay.
You track your desired response, which is to get out of the way or stop it or punch the person or rage,
Yeah.
these visceral emotional reactions that are out of character, by the way, but in that situation present themselves. And then the psychologist works to prevent that response, by breathing techniques or by psychosensory distraction.
Because like sometimes it can create tension with a person
Mm,
randomly, right? Because like they will not know if you don't talk about it and the person in front of you don't know that this is what you're going through because of, let's say, them breathing loudly or anything else. Sometimes it triggers you, so you get annoyed and you get pissed at that person.
yeah,
And it's like, why are you pissed? I didn't do anything,
yeah,
and you're mad about that thing that he doesn't know about, right?
yeah,
And this is triggering, so
yeah,
and it happened with me a lot of times. So
yeah. Me too, me too. It's really bad, like some people that I love so much, I have to avoid. Yeah,
yeah.
they might invite me if they might invite me round to watch a movie of theirs. I'm like,
I'm sorry, I'm busy.
yeah, that's not happening because I will murder you for breeding that.
Yeah.
Whilst we laugh about it, I want to keep emphasizing that this is serious.
Yeah.
For the sufferer, it is really serious. It's pretty debilitating. It really affects relationships.
That's true.
One thing I've not talked about is the it's a terrible word, but comorbidity is a word used in psychiatric parlance, and it means coexistent. The word morbidity is awful, but morbidity as in like illness, disorder. Misophonia has a high frequency of coexistence with anxiety, general anxiety disorder, GAD. OCD is really high. Autism is
Okay.
quite a high coexistence rate. And this is totally anecdotal from my experience in therapy and my experience as a psychotherapist and a little bit of research. I have this hypothesis that it's about attention. There's an attentional bias that we have and that misophonics have, and that there is in OCD and there is in a lot of these other disorders. You're allocating attention to this sound in a way that is kind of disordered.
So I'm not sure if I have these, but for example, for me at least, I'm so good at opening multiple subjects in the same time, opening parentheses in the same time. So I can talk about something now and then 2 seconds after open another without even closing this first topic, but coming back to this without even like knowing where I was and so on and continuing the discussion, you see?
That's interesting.
So it's just like a lot of topics in the same time, so
Mm.
yeah, and because suddenly I have another idea that I want to say it in that, and then go back to this initial topic that I was discussing. So I'm not sure if it's related in any way, but I mean, I have it.
Have you ever
Yeah.
have you ever done an ADHD kind of
I did it. I
you know
know.
have you ever felt like that's been an issue or
I mean, I read about it.
right?
Maybe. Can you
Do-
tell me more?
Well,
Or another episode?
I mean, it's always a bit irresponsible for psychologists to start throwing out ideas. I'm not suggesting that you have ADHD, but one of the symptoms of ADHD are maybe that kind of flickering that you mentioned. But it's more of an inability to focus on one task, whereas you're sort of saying that you have the ability to focus on many tasks. People with ADHD also might find themselves interrupting people, not being able to stay on topic. They might be quite forgetful, forgetting things often. And
I have these things. Interesting. I need to read about it more, to be
right,
honest.
I mean, it's kind of spectral.
Mm.
So it's on a spectrum in the sense that a lot of people will have these things,
Mm.
but someone with ADHD might find themselves struggling to actually get around life in a way that it
No, I'm fine, I guess.
You know,
I
like
hope.
it might cause more significant disruption.
Mm.
But yeah, there's quite a high, um, high prevalence of anxiety disorders and ADHD with misophonia.
Okay.
And I just think it's something to do with attention.
Okay.
And I'm involved in research at the University of Birmingham in Dubai, with a couple of colleagues of mine on looking at brain region and misophonia. We're putting people who score high on a diagnostic set of scales looking at misophonia. We're putting EEG scanners on the brain.
I mean, if you want, I can be part of your
Well,
field
thanks.
study.
I was just about to pitch it, yeah.
Yeah.
And we're gonna play.
Without weird stuff, right? So, yeah.
Well, yeah, we're gonna play some trigger sounds and see where, which parts of your brain are kind of active.
Okay.
But the novel part of our study is going to be that we use VR, virtual reality, to actually see your partner doing the trigger sound. Because familiarity is a big issue in misophonia. You're going to be way less triggered by a stranger, on first
I can
trigger.
surprise you, to be honest.
Well, I mean, but usually people are
But
much
I
more
understand.
triggered by, familiarity. But yeah, you're right. Like, someone that I hear in the cafe next to me chewing that, I'll be just as triggered by that. But it takes a bit longer to realize the sound,
True.
So I feel like I want to make sure I've done what I had in my head on the plan for this podcast, which is we've definitely gone over the symptoms, the
Yeah.
trigger noises.
If there's any solution, we talked about this.
Yeah,
But
solutions.
there's no concrete things to do. Like, is
No.
there any maybe exercise that we can do or anything just like concrete that we can automatically try to, I don't know.
Well, what I do is notice a name. So that's I am noticing that I'm having the thought of rage connected to the sound. I'm noticing the anger in my chest. I'm noticing the response that I have right now, which is to get out. Just saying that out loud or in your own head gives you a chance of defusing from the emotional reaction that you have to the trigger sound, right? So that can be really helpful. Earplugs do help, but the trouble is, the more you wear them, the more you become reliant on them.
Yeah.
And I find that when you stop using them, then you're really hyper attentive to the sound. Playing white noise. Personally, I like to have noise all the time in my apartment. It used to drive people of my past insane because I would just constantly have music loud.
Okay.
Yeah, I want music playing all the time because it kind of drowns out those high frequency
true.
noises. So that helps for me. And I would say start with, seeing a therapist, discussing options, CBT, white noise, and see how you go. But I want to be more hopeful, but at the moment we don't have a cure at all.
Yeah.
And there's such a strong, an emerging but strong evidence base that this is in the brain. So
Yeah.
there ain't much you can do about it.
Yeah, because like you feel that the other person is he doing on purpose just to annoy me or
Yeah. And see, that's where CBT comes in. So that can help with, because that's about the meaning that you make from the sound, right? And I have that as well. I've had that in the past where it's like, why are they doing that? Did they know? Do they not know?
Exactly, yeah.
And then it starts to, you get angry at the person. And that's the bit that you can work on in therapy. You can work on that. But it's not easy. This is a real, paralyzing,
I know.
emerging disorder.
From nothing, right? Like as someone is sniffing or something, like take a tissue. That's it.
Yeah.
So, yeah.
Now, in relationships, I would say that the best thing you can do is find a way to talk about it. It's awkward and it might create a lot of friction. If you can find a way to communicate about it, and if your partner can find it in them to let you have your outbursts, and if you can laugh about it, I have had that, and it actually solved the problem. I could coexist with it.
Yeah.
But what that requires is for the partner to realize that it's not, even though it feels so personal, it's not personal. It's not. I don't hate you. I love you. It's the sound, right?
Yeah. Same thing with friends, actually. Just like, because, I mean, they are your friends, right? And you're just annoyed by this thing, but you feel, how can I tell them without being, like too much or, high maintenance or, because it can be triggered, like, can be taken like this also. So,
Right. Yeah. Thank you so much there. That actually feels therapeutic in and of itself.
yeah.
And that's another thing I was going to say. If you can find fellow sufferers, if you can find people that suffer, peer-based support groups.
But you're not
are
alone, actually.
great. Yeah,
Yes.
they're really good. There are some peer groups for anxiety disorders that are not so common. And so if you can find other people that struggle, and if you can find people that also bring family members, that can be really protective as well. Thank you so much for listening, everybody. I want to make a few points there. Just re-emphasize that if you suffer with misophonia, if this sounded really familiar, you are definitely not alone. And I, for one, have a lot of empathy with you, and so does Leah. There are some ways to go about getting treatment. The first protocol is probably to book an appointment with a therapist and explore CBT. Um, get in touch with me directly, and I'll respond as best I can and give advice. But yeah, you're not alone. For partners of people suffering with misophonia, please try to find some empathy. I know it's so difficult. There is nothing your partner can do about this. It's a neurobiological response. So find forgiveness and please try to laugh about it. Just lean into how ridiculous this is if you can. It's serious in the sense that there's not much we can do about it, but we can still find it ridiculous and we can find a way to laugh about it. And for me, that's been something that's been so valuable. Thanks for tuning in, and I'll see you next week.